Mammen, the men's hostel is really going to miss you, and it is going to be very difficult to fill the void that you'll create by leaving us. Goodbye, Mammen. You have given success a wonderful name. Will you come on up and say a few words as you leave us?
Thank you, Vishy. What can one say about 6.5 years of one's life in a place like Vellore? I find myself at a loss for words. But I think I'll begin by saying a few thank yous. Thank you to the members of the faculty who have taught me not only the techniques of my craft, but also its art. To my parents for having made all this possible. To this institution for the fantastic years of my life that I have spent here.
Vellore obviously has a charm of its own. I came here 21 years ago for a postgraduate training in surgery. Originally I had meant to stay only for the period of training, but this place was so attractive. Many of us who came stayed on. We found not only professional satisfaction, but there seems to be some purpose in this community living in this place.
When I finished my professional course in statistics and was confronted with various jobs that are available, when I found that there was a vacancy at this institution, I almost jumped at it, because I felt that here is a place where you could not only develop professionally, but be able to have and share the Christian life and the spirit of Christ. We are always reminded that we are serving Christ, and I think this is a very important part of our life. This is what keeps us all ticking and makes us continue in this place.
Many more young people apply for medical training at Vellore than can ever be accepted. Applications come in from all over India, from neighboring countries like Malaysia and Ceylon, and sometimes from as far afield as Hong Kong or Jamaica.
What do you say, Peter? Have you ever seen a kid? Huh?
Good morning. What do you have for us today?
So on examination, the patient is...
Mammen had now reached his 6th and final year as a student. His home is in South India, and when he applied for a place at Vellore, he was sponsored by his local church.
The JVP is elevated. It's 6 centimeters above the sternal angle. There are no other important features on general examination.
What about the blood pressure?
So the blood pressure was 110 by 90.
In the thyroid gland are the parafollicular cells, which are also called the C cells.
Asha has been at Vellore for just over a year and does her preclinical studies at the college. Asha comes from North India and she's a Hindu. Her parents were very keen for her to receive her training at the Christian Medical College, although they realized that her chances of getting in under open competition were very slight.
Dr. Kapadia, you mentioned just now that there are different types of cells. Now, do these cells have different, do they produce different hormones like in the thyroid, or is it something else?
The chief cells...
The college admits 60 students a year from a total of more than 3,000 who apply. 45 of the places are reserved for sponsored Christian students like Mammen. Unsponsored candidates like Asha are competing for the remaining 15 places, but they all take the same written examination. These results and other confidential reports form the basis on which the best 100 candidates are selected for interview. An invitation to go for an interview brought Asha one step nearer to Vellore.
They come here for an interview where we are able to personally assess their motivation. We attach a great importance to this motivation of these students because this college has traditionally tried to train doctors to serve the needs of India. The various Christian denominations have over 400 hospitals. These sponsor students who give an undertaking to serve in hospitals situated in the rural areas, and 70% of our admissions are reserved for students who are willing to work for the need of the country, particularly in villages.
I arrived here by train. There were quite a few interview candidates on the train, and we were received by the college bus and some students who checked in our names, and we were brought to the hostels where we were put up for the 3 days of the interview. And people were very friendly, and they told us that this interview was nothing to worry about, and I was quite impressed by the place, the stone walls and a lot of greenery around here, which you don't see in a city as much as you would here. And then we were interviewed for about 3 days.
We want to be sure that we are selecting the best candidate for training in medicine. And it is not easy to define a good doctor. But we could state that the candidate should have a good academic career, should have good potential, should be committed to work in needy areas, and is able to be sensitive to the needs of others.
Maybe you should try to get up by 5:30. In any case, you should be ready to start the interview program at 7 a.m. We'd like you to be your normal self. The more you relax, the better chance you have of showing what kind of a person you are. So the first and perhaps the last advice I can give you here is that enjoy yourself while you're here. And as you know, only half of you can be selected.
Hey, come on, hurry up.
We have a 3-day timetable, and there are group tasks in which candidates are
observed in groups of 10 as they perform tasks like constructing a house or preparing for an exhibition or arranging a function. These candidates who have not known each other get together for the first time, and we have an opportunity to see leadership qualities, accommodativeness, ability to get people to work together. And we also have individual tasks where a shy, retiring person who has enough potential can reveal what these potentials are. For example, we have tests to show the patience, neatness, skill at handling a certain job, creativeness. All these can be assessed, perhaps not in a group, but given a certain specific task.
When you have a nice figure, you
Come
can
on, you got to train your brain. Come on, at 40. You can't.
You're both not supple enough to
Come on, I've seen people.
We were given some topics for discussion, group discussions, working in a group, doing things. And all this doesn't just test your ability to mug up a subject and repeat it, but personality, character, and your capacities and capabilities, whether you can go ahead with the full course of medicine, whether you can get along well with people and get along with your patients also. Personally, I think this is a very good idea.
Oh, you're from Bombay, isn't it?
Yes, that's right.
How did you happen to apply to CMC Vellore when you have so many medical colleges right within your own city?
Well, firstly, I couldn't enter any of them straight after school. And besides, Vellore's got a terrific reputation, even in Bombay.
You study this picture and then briefly describe the situation and tell me what you would have done if you were on the spot as an onlooker.
Yes. Well, there seem to be 4 people in the forefront and 3 onlookers. Since the onlookers are looking rather sad and they don't seem to be doing anything, these people, as I presume, are dead or almost dead. You can't say because...
We believe that the more people that are engaged in this task of selecting students into the college, the better it would be. Each staff has got his own way of looking at things, and we have tried to involve some staff as observers to assess the personality of the students, some staff to assess the aptitudes of the candidates, and then all these people would get together, evaluate the evidence on each candidate and make the final selections.
I believe this rating has been a little lower than what it should have been, taking into account his background and the other difficult circumstances through which this candidate has gone.
He is a sponsored candidate and he knows the implication of sponsorship.
Only 4 in every 100 applicants are called for interview, and only half of them can be selected. Those who fail have the consolation of knowing that they had done extremely well to get even this far.
Change his attitude to life. We rate his overall suitability for admission to Vellore as C. Can I have your comments or questions on this? Hey George, do you think there are any crepes in the right place?
I think so.
Although there are more places reserved for sponsored students than for unsponsored ones, the same standard applies to all. Mammen was one of the best students in his year.
Rachel, I think I can hear the fetal heart above the umbilicus. Could you just feel whether the head is felt in the funnel region? I think this may be a breech presentation. Amma, evlo maasam aadu? 9 maasama. Kadasi May maasam.
One of the conditions of sponsorship is that the student undertakes a bond. It means that once he's qualified, he will serve at least 2 years in a church-supported hospital. They are usually in rural areas. It provides a period in which a young doctor can increase his experience of the ordinary health needs of the country, and it also gives him time to decide where his future should lie.
All I can say about my interview is that I didn't think I would be admitted, so I never gave it a second thought. It never struck me till after I had been admitted and my father sort of calculated the figures and said I had been selected out of so many that I realized what a competition it is. And somehow when I started off, I didn't feel that I deserved it. I was quite sure there were many others who could have done better.
Less than 60 years ago, it was unheard of for any Indian woman to be trained in her own country to become a doctor. The person who changed all that was Ida Scudder. Ida Scudder's father was a medical missionary, and her childhood memories of India made her determined to spend her life in America, like many of her friends. She had been appalled by the suffering and inequalities of Indian society. She was 21 and visiting her parents in India. One evening, there were 3 separate callers to her father's bungalow: a Brahmin, a Muslim, and a Hindu. The first man said his wife, a girl of 14, was dying in childbirth. Ida Scudder went to fetch her father, but the Brahmin stopped her. He would not have another man look upon his wife, no, not even a doctor. As Ida Scudder herself had no medical training, she could only plead with him. But the man departed. The same thing happened twice more in the space of a few hours. Each man had a similar story to tell, and each refused her father's help. It was the longest night of Ida Scudder's life. The next day she inquired about the fate of the 3 women and was told that all of them had died. It was at that point that she decided to return to America and study for a degree in medicine. Ida Scudder returned to Vellore in 1900 as a qualified doctor. For 2 years, she ran a clinic in her father's house, and then the Mary Tabor Shell Hospital was built with accommodation for 40 patients. It is now the eye department of the main hospital. In 1918, Dr. Scudder fulfilled her ambition to start medical training for women students. To the astonishment of the authorities, her first group of pupils all passed the university examinations. This was the beginning of the Christian Medical College, which today trains men as well as women. The town of Vellore was always an important local center, but no one could have foreseen how famous it would become through the institution that has grown up there over the years. Vellore is one of the largest medical centers in Asia, and its unique situation in a country town has meant that the needs of rural India have become a fundamental part of its work. The present hospital site was acquired in 1924, and year after year, with the help of money from abroad, new buildings and departments have been added. Although it has increased so much in size, Vellore Hospital still tries to live up to the ideals of the woman who founded it. People pay according to their means, and many are treated free of charge. Some can barely afford the journey from village to hospital. Private patients are looked after in a separate wing. Many of them have travelled a long way to receive specialist treatment. The doctors at Vellore have no private practice as such. The fees for their services are paid to the hospital, and in this way, through the patients, India contributes most of the cost of running a modern teaching hospital. The doctors themselves work for a salary which is far below what they could earn elsewhere.
When one looks at the way in which our medical colleges evolved from very simple beginnings to an extremely sophisticated medical center which can hold its own in this country as well as in some of the other countries, we begin to wonder whether we are giving a type of education which will produce the kind of doctors who will be happy and technically competent to take care of the common problems in the countryside. Most of our population is in the rural areas, 80 to 85%. And the kind of problems that they have are the so-called very common problems, common from the point of view of modern sophisticated medical technology. Things like diarrheas and dysenteries and respiratory diseases and malnutrition. We have a mobile unit which we call a roadside dispensary, where we go out as a team with a box of medicines and a few other things to try and treat diseases of people who will come to regular so-called stops. Now, the big disadvantage about this program is that the same patient may not be seen again for months, and there is no time for educating and in preserving health and preventing disease. But insofar as we are there, some of the sick people will come and get their needs met. We also try to give him, during the internship period, a kind of training which will likely to make him what we call a general practitioner. The kind of person which many years ago was called the horse and buggy doctor. And if this person who can deal with the common problems of ear, nose and throat and respiratory diseases and gynecological problems and also problems of children, in other words, he becomes a combination of many mini specialists, you might say. It is also important for us to convey to him that he has to understand people and their cultural taboos and religious beliefs about disease, and as the more he becomes aware of the importance of this, the more likely he is to be effective in trying to change people's health behavior. We are moving away from getting them involved in the moving dispensaries to the health center situation. So we get the students studying families for a period of 12 to 14 months, making weekly visits. And then during the internship period, we again make them actually take care of families in the setup of a health team.
I suppose if a person is dedicated enough, he shouldn't mind going into the villages. Even in the urban areas, you do find a lot of people who still are not aware of what to do when there is any sickness. And visiting a doctor is very expensive. Another thing is that people are still very conservative. They have their own customs and habits which are very difficult to overcome. Very few people are aware of the fact that you must keep yourself and your surroundings clean. They may have a bath every day, but their surroundings might be filthy and dirt and rubbish all over the place, and children play in the mud and they aren't washed properly, and they do not know the importance of washing hands, say, before cooking. I think what we need is a lot of health education.
Community health is an important aspect of training for nurses as well as undergraduates. Their job is to follow up the families which have been visited by medical students. Ida Scudder started a school of nursing in 1909 with a class of 9 girls. Today, the college has more than 300 nurses in training and, like the medical college, can only admit a tiny proportion of those that apply. The college also trains the teachers who will staff schools in mission hospitals and government service. Modern medicine demands skills in many disciplines to back up the doctors. Training for such essential people as pharmacists, radiographers, and laboratory technicians was soon established, and Vellore has collaborated with the Christian Medical Association of India in setting the standards for such courses. More recently, training for those who will work for the disabled and in hospital administration has been provided in Vellore. Some of the early courses now work to diploma standard. For others, a Vellore certificate is recognized all over India. On an average day in Vellore, there may be 90 or more surgical operations. Major surgery will involve a large number of people of different skills who work together as a team. In the middle of an operation, a surgeon may ask for an examination to be carried out of a diseased tissue. It's obviously essential he gets the biopsy report back with the minimum delay.
Hello, this is operating room.
While the theatre sister telephones the pathology department, Mammen is already on his way with a sample of the tissue which the surgeon has removed.
There is no pleomorphism or hyperchromatism. The lesion appears to be quite acellular.
The specimen shows no sign of malignant disease. Welcome news for the patient when she wakes up. The pathologist telephones the surgeon with her report.
May I speak to the surgeon, please?
But no, you say it's just not worth it. No, just think
Away from the immediate pressures of the hospital, students relax with their friends. Idle discussion soon gives way to lively debate about the issues of the day.
It was just a desolate house, and they started practicing, and now there's a hospital which is paying for itself, mind you. Okay, but
We do a lot of things here to keep us going because Vellore is a small place and there isn't much by way of entertainment. We have an occasion for everything. When the final years are leaving, we have a dinner for them. When the freshers come in, we have a welcome dinner for them. We have carnivals on the Republic Day and Independence Day, and a whole lot of other activities, sports, dramatics.
Was last observed, which suggests to me that you must have kept a rendezvous and driven off with him in your car.
That is a monstrous allegation.
No.
And
Hold it. See, this denial must be much more vehement. You've got to get up much more vehemently.
One thing remarkable about this place is Christians and non-Christians, sponsored and non-sponsored alike, they're all treated the same way. So we don't feel any different from the rest.
During their years at Vellore, there are a number of opportunities for students to take part in some form of voluntary service. Every so often, a party of them go out on a work camp, when they live among village people, and also help in some specific project like building a house. camps are organized by the senior chaplain, and although his presence underlines the Christian motivation, non-Christians also join the junior staff and students who make up the party.
At the work camps, we are helping the other person, and at the same time we are spending a bit of our time in some useful work, and we can understand their problems better also. We feel part of them. I mean, like we are all people of the same country, nation or area, and our relationships improve in that way.
Only mud.
One of the reasons why Vellore is different from other medical colleges is because of the fellowship that exists between staff and students, and I do not know whether it is because it is a Christian institution that this is so. I cannot ascribe it directly to Christianity. But as far as my personal life is concerned, I think that the fact that Vellore is a Christian institution has helped me in sorting out a lot of my problems as far as my faith is concerned. Another point about Vellore which I think is important is the relationship that exists between the patient and the doctor. I think here one realizes that it is important to treat one's patients as human beings, and the best way to learn this lesson is when one sees it actually in practice. I have seen my teachers treat patients really as human beings, to be bothered about them, their families, their problems, to be concerned with this individual as a person who has a problem which needs to be solved, and not just a syndrome of interesting clinical features.
Very good pain.
In many ways, besides the teaching and the facilities, the people here have an attitude of service to humanity, and all the doctors and nurses want to help the patient as much as possible. We're just all one and the same.
Now come on, stand straight. Straight. This part, go forward. This part forward. Come on, loosen the shoulder. Loosen the shoulder. Don't try to tight it. Come on. This part straight. If you got pain, you please tell me. Pain. Where you got pain? Hips. Hips, Left. Okay. We'll slowly bring you down. Come on.
Okay, stand straight.
Come on, stand straight. We'll put you back now. Come on. Slowly sit.
The heart of Vellore is the chapel, the center of daily worship and the inspiration of its life. It's seldom empty. People come in spontaneously to pray, or some to light a candle. Her child is a patient in the hospital. He was so ill when she brought him in that the doctor didn't think he would live. But he had lived, and tomorrow she will be taking him home. She's not a Christian, but she expresses her thanks in her own way. Somewhere in the hospital, a service is in progress. For the patients, another day is ended.
Poverty, sir. I suppose I could go on. But and now, coming to my future plans. I have been sponsored by the Mahatma Church, and therefore, for the next 2 years, I will be completing my bond obligation in a mission hospital. Here, I hope to be able to do some of the things which to me form part of the romance of medicine, like incising a few abscesses, treating a few malnutritions, delivering a few babies. During this time, I would be able to decide whether I would fit into a rural setup, which I suppose is what this country needs most.
Asha must also decide what to do when she leaves Vellore. When the time comes, will she, a Hindu, with the same training and the same experience of working in a Christian hospital, also consider practicing in a rural area? It is through the lives of these young medical students that the work of Ida Scudder continues. The flame that burns so brightly now was lit one evening a long time ago.